Hello, my name is Fintan and thank you for visiting. I believe in letting nature take care of us, especially when it comes to our health. So today in this video I'm going to talk to you about pain relief for hip pain. When it comes to hip pain, I know something about this condition because I suffered for a couple of years with chronic hip bursitis pain until I found a pain relief for hip pain that works. So what are the causes of hip pain? There are several conditions that cause hip pain. If you have hip pain, it's important to get a proper diagnosis so that an appropriate treatment can be prescribed for you to get some relief from hip pain. One of the most common causes of hip pain is bursitis. Bursa are small pouches or sacs filled with fluid designed to cut down on friction when there is movement between tissues in the body. There are two major bursae in the hip area. Wear and tear can lead to a reduction in the cartilage surrounding the hip, causing the bursa to become inflamed. Sometimes the bursa can become infected. Non-infected bursitis treatments include rest, ice pack, prescription medications for swelling, inflammation and pain. Infected bursitis may need antibiotics, drainage or surgery. There are two types of hip bursitis. Trochanteric bursitis, which causes the outer hip area to become tender, and ischial bursitis, which causes a tiresome pain to the upper buttock area. So let's talk about trochanteric bursitis. It's very common and it can affect anybody. Women in the middle to elderly category are susceptible to it. People who do work of a physical nature like tradesmen and farmers are at risk also. Sports people or hobbies that involve repeated twisting or swift movement of the hip joint fall into the same risk category. We do hear a lot of people that garden, jog, cycle long distances, play tennis or golf complain of hip pain. An individual's response to hip pain will vary. Some people feel a small amount of discomfort, which is annoying, while other people get a much more intense level of pain. The corresponding level of treatment will vary accordingly. Trochanteric bursitis very often causes tenderness and pain in the outer hip and thigh area, making it hard for people with this condition to do simple daily tasks such as standing in the one spot for more than 5 minutes, climbing a stairs or sleeping. The tenderness and pain are exacerbated by excessive exercise or walking. Irritable band syndrome can be like and associated with trochanteric bursitis. Irritable band syndrome. The irritable band is located on the outside of the thigh muscle. It covers from the pelvis to the tibia as it crosses the hip and knee joints. The irritable band works to stabilize the movement of the knee and joint. People who run a lot use the knee joint repeatedly, and this overuse can cause inflammation of the irritable band and pain. Ischial bursitis. The ischial bursa is a fluid-filled sac found in between the hamstring muscle and the ischial prominence of the pelvis in the buttock. This whole area holds the full body weight when sitting. One of the largest joints in the body is the hip joint, which is kept stable by the hip capsule, muscle ligaments and cartilage. Surrounding this area are bursae. These are filled with fluid and play a pivotal role in reducing friction between the tendons and the bone. So ischial bursitis of the hip can be caused by something as simple as sitting on a hard surface for too long. A fall on the hip or lying on the hip for long periods of time may trigger hip bursitis. During activities, friction can cause injury to the ischial bursa and can make the muscle weak. Bursitis can be a side effect of rheumatoid arthritis, osteoarthritis and gout. The ischial bursa may become swollen in response to other hip conditions. So what are the symptoms of ischial bursitis? Well, the main symptom of ischial bursitis, even though you can't see it, is redness and swelling around the bursae. Usually pain in the buttock area when sitting down, ache or stiffness in the pelvis area. Your sleep will be affected if lying on the affected side. So when should you go to see your doctor? Well, these are some important questions to ask yourself. Have I had hip pain for more than 2 months? How long does it last? Do I have hip and leg pain? Do I have pain in the buttock area? Do I have hip pain when standing? Do I have buttock pain when sitting? Do I have hip pain when I walk or run? Do I have hip pain when lying on the affected hip? If your answer is yes to more than 50% of these questions, the chances are you have hip bursitis and you need to get a diagnosis. Your doctor will do your diagnosis and he will begin with a full physical examination and a thorough review of your symptoms. Your doctor will ask you to move your legs and hips. You may also have to sit and stand while the doctor takes notes on the symptoms. The cause of your symptoms may not be obvious from the physical examination, so you may be sent for an X-ray of your pelvis area for a better view. The soft tissues surrounding the bursa may need to be looked at in greater detail by using an MRI scan or ultrasound. In certain cases, a sample of fluid may be taken from the affected area. So what are the treatments for hip bursitis pain? Well, we know the bursitis of the hip causes hip pain, so what is the best pain relief for hip pain? Really, it boils down to temporary relief in the sense that the pain will be reduced but will come back, or permanent hip pain relief where the pain goes away and doesn't return. So temporary pain relief for hip pain. Temporary hip pain relief comes in the form of rest from the activity that is causing the hip pain. For example, if you like to run but it causes hip pain, then it would be advisable to cut down on the running. If your hip pain is caused by an infection, then your doctor should be able to help you there with an antibiotic. If your hip pain is caused by wear and tear on the cartilage leading to hip bursitis, you could go to a physiotherapist for assessment, and they may recommend you do a range of hip strengthening exercises. Some people have found temporary relief for hip pain by getting an ice pack and holding it to the affected area. This needs to be repeated 4 to 5 times per day and should provide some temporary relief. If your hip pain is acute and causing you difficulty as you go about your daily tasks, then your doctor may offer a cortisone injection for pain relief. Permanent pain relief for hip pain. The problem with all the above hip pain treatments is that they will only be temporary because the bursae surrounding the hip will become inflamed as soon as the treatments wear off. So you need to tackle the root cause of hip bursitis, namely inflammation. By tackling the inflammation, you have control over the swelling and the pain. Pain relief for hip pain. Joint Advance is a natural product that was designed with you in mind. Its unique formula will work to strengthen your hip joints, remove the hip pain, and have you jumping around again. This is what one of our customers had to say about Joint Advance. I just turned 70 years old. Joint Advance has really improved my flexibility and mobility. I don't wake up with aches and pains, which is great because I love to garden and walk around the parks. So why not visit our website for more information on hip joint pain relief? Thank you. Hello, my name is Fintan and thank you for visiting. I believe in letting